Fibroids are benign growths in the uterus. Benign, it's important to know that they're benign, meaning that it's non-cancerous, but in some people, and very rarely, sometimes they can actually progress to malignancy, but most of the time, fibroids are benign. I think many people actually have fibroids. One, they don't know. Number two, they're afraid to get a diagnosis. Number three, they're afraid of addressing the problem because people sometimes think, oh, I have fibroids, so I can't get pregnant. You know what I'm saying?
Hmm.
It's not a definite, contraindication to pregnancy. It's not
Yeah.
like a cause of infertility. Even
Hmm.
black Americans, like black people in America,
Hmm.
Africans in Africa,
Hmm.
they are disproportionately affected compared to their white counterparts.
Yeah.
So I think it's a very strong mix of genetics. And then also people have postulated that things like relaxers, the stuff we put in our hair,
Hmm.
even the hair itself,
Yeah.
right? There's potential that those can down the line actually, have some form of disruption of hormones and things and can predispose to fibroids.
Now
And
I'm working on this image, and don't be laughing at me now. I've not even shown you what it is.
oh,
And
okay.
the image is not yet finished. So there's still a lot to do to this.
I can
Because
imagine.
Hello everyone, welcome to my channel. This is the K Touch. My name is K and we have art and conversation. And today I cannot wait for you to see and hear from the guests that I have on my podcast today. So I have Chinonso Asinugo on my podcast. She's a friend of mine. I've known her, I think, for about 2 decades, 2 or 3, I don't know, but I've known her for a while now. And she's a medical doctor as well. She's got a lot of experience and she's going to just come and we're just going to catch up, vibe, and we have a very important thing to discuss as well. So I can't wait for you to be a part of it. Welcome again. Hi, Chinonso. Welcome to my channel.
Thank you. I love the introduction. I was just waiting to like clap and do like drum roll and everything.
Clap for it is so amazing to have you here. Chinonso, I don't see you often. I probably see you once or twice a year, and we've actually not even. There was a time there was a brief, no, will I say brief, long hiatus when we hadn't
Very brief, very
communicated.
brief.
So for those in the audience, Chinonso and I had a brief quarrel, and we've just reconciled in our own little way.
Barely a quarrel, but sure.
It was a long one.
It wasn't,
Chinonso,
that's it.
can you remember how we met?
Ah. I don't remember specifics, but I know that at some point in my life, I started going to teen church. So I graduated from Sunday school, and then my cousin Nene and I, we started going to teen church. And I think that's where I met most of my church friends, really. I'm not sure where you guys were when I was in Sunday school, but I
Hmm,
know that I met most of like youth staff people when I joined teen church.
yeah. And well, I can't remember as well, but all I know is that it's always been a good time having conversations with you, and I don't even understand how things went, and we didn't talk for a while. But here we are, and
Here
we're
we are.
moving forward.
2025, we've moved on.
2025, we moved on. We've moved on. So again, congratulations. Another year. It's your birthday. I am so glad to be a part of that. I'm celebrating
Actually,
you.
your anniversary around this time, isn't
Yes,
it?
my
Yeah, like
anniversary.
second
My
of June.
anniversary was on the first.
Yeah, right? Because I need also about my birthday. Oh my God, congrats.
Congrats
Yeah,
to
I
you.
remember. Yeah, congrats.
So my wedding anniversary, your birthday.
Congrats, congrats.
Amazing.
Nice. How many
Um,
years now?
9. I know it's just like yesterday.
We'll do a party next year. A big one.
Oh wow, I hope you had a good one. Anyway, so now you're on my podcast to discuss a very important topic. Dr. Chinonso is going to be talking to us a bit about fibroids. Chinonso is probably going to be surprised about how little I know about it, but it's so important that this is discussed, and I can't wait to hear what Chinonso has to share about it. So I'm going to dive right into it, Chi. Please, what are fibroids and why are they so important?
So basically, fibroids are benign growths in the uterus. So it just basically means that some people have an excessive production of tissues in the uterus that can subsequently give them complications, I would say. It's important to know that they're benign, meaning that it's non-cancerous, but in some people, and very rarely, sometimes they can actually progress to malignancy, but most of the time, fibroids are benign. And
Okay.
when it is malignancy, it's called something else. Why it's important is I think many people actually have fibroids. One, they don't know. Number two, they're afraid to get a diagnosis. Number three, they're afraid of addressing the problem as
Hmm.
well. It's something that has affected me personally, and it affects a lot of people as well. I know lots of people that have had fibroids, that have had to, have surgery and things. So I think it's something important to for people to be more aware of.
Yeah, yeah, and it's so interesting that although it is so important, and it's something that people have know in one way or the other, but shockingly, every time that I've had the opportunity to be engaged with it, everything that I've heard about it seems to just be hearsay. I haven't actually even, for something that is so important, I haven't even
Mm-hmm.
ever investigated it myself. And I have known people who have been either affected by it or, it's just always in the airways, but never
Yes, yeah.
really hitting home with me. And it's quite a shame, really. But thanks for turning up to discuss it.
Mhm.
It was only after I spoke with you that I realized its impact, its disproportionate impact on Black women,
Mm-hmm.
women of African heritage. So we're going to be going into this on one angle. Can you tell us a bit about fibroid and pregnancy, um, and its
So
chances of affecting pregnancy?
So I think it's an urban myth that fibroids affect pregnancy. When we were in training, they basically said they taught us that it didn't, but practically it can, right? For example, the uterus is an enclosed space. There should
Yeah.
be nothing there. You have this growth that is, abnormally protruding. It can sometimes affect implantation of like an embryo.
Hmm.
So let's say there was fertilization, the embryo was supposed to attach at a particular spot, but the fibroid is there. It can cause it to be displaced, right?
Okay.
Numerous people still go on to have successful pregnancies with their
Mm.
fibroid. So they're basically carrying a child and also, carrying a fibroid as
Yep.
well.
Yep.
But that can also sometimes result in complications with delivery because of the positioning, it can, affect how the baby is positioned. It can also cause additional complications in terms of actual like birth
Yeah.
or having to have maybe like a different type of cesarean section if they need to, just because the fibroid is there.
Hmm.
So ideally, we recommend that if you have plans of conceiving, it's always good to address the fibroids ahead of time, just so that it doesn't cause complications with conceiving,
Yeah.
with carrying the pregnancy, and potential complications with delivery as
So
well.
it's
But it's
more
not impossible.
yeah, but what you're trying to make us see is it's more the probability of it. It's not a definite
Hmm.
yes or no it
Yeah,
will affect.
exactly. Because people sometimes think, oh, I have fibroids, so I can't get pregnant. You know what I'm saying?
Hmm.
It's not a definite, contraindication to pregnancy. It's not
Yeah.
like a cause of infertility. It
Hmm.
can affect all the different factors because there's different things that contribute to infertility and not being able to
Yep.
have a child,
Yep.
right? But
Yep.
it can be one of the contributing factors, but it's not like I have fibroids, therefore I can never get pregnant. Or I'm
Yes.
afraid to do fibroid surgery because I want to have a child. And I don't
Hmm.
think I can have a child after,
Hmm.
kind of thing. So, yeah.
Wow. Okay. Thanks for that one. How is it that such a thing can be reduced? Well, you've already said that in terms of controlling it, people might want to consider some kind of intervention if they want to have children
Mhm.
for it. So we'll come into the details of that later on. But why is this very important, mostly amongst Black population, African
Okay.
population, African Americans, and all of that?
Honestly, we don't know. And
Okay.
it's always sad when we say in medicine that we don't know, but really we don't know. But I think it's a good mix of genetics, and environment as well, right? Because if you take a look at it, it's like even black Americans, like black people in America, Africans in Africa, they
Mm.
are disproportionately affected compared to their white counterparts.
Yeah.
So I think it's a very strong mix of genetics. And then also people have postulated that things like relaxers, the stuff we put in our hair,
Mm.
even the hair itself,
Yeah.
right? There's potential that those can down the line actually, have some form of disruption of hormones and things and can predispose to fibroids and even like ovarian cancer, uterine
Yeah.
cancer. There are still some, studies in the early stages, but
Mm.
that's some, and because if you look at it, it's really black women that relax their hair, that
Yep.
do extensions,
Mm.
so there's that, there's like environment, there's diet, who knows, but
Mm.
genetics is
Mm.
a very strong thing. Yeah,
Wow.
so.
That's just when I saw it initially, when I saw the reports, statements in some,
Mm-hmm.
bodies that Africans are disproportionately affected by it.
Mm-hmm.
It, I won't lie to you, it almost got me upset. I almost got really upset about it. And it's not because I just generally didn't like the fact that it was disproportionate in that aspect, in that angle.
Mm-hmm, mm-hmm.
And I can't help but wonder if there's anything that can be done to stop that. But
Yeah, yeah.
um, do you think that enough from you, and I know the amount of information you can give is somehow limited in terms of what you're willing to share, but do you think that there's been enough investigations or enough, people studying it affecting that particular population enough, or is it, or do you think that more needs to be done?
Mhm. I think on a larger scale, more obviously needs to be done. Now it's getting to the point that we as Black people are getting more empowered. We're doing more targeted research, that kind of thing. It's just like,
Mm,
okay, we've been doing relaxers. We're seeing
mm,
that, okay, what's actually the side effects of this thing? Like
yeah.
this has been there for years, but what is the implication on, our
Mm,
population? So if we ourselves as Black people do more research, we can actually do things that target specifically, to us. So I
mm,
think on the grand scale of things, like, making it more larger scale, we definitely need to do more studies because even all these people, they're smaller companies, smaller groups. The case studies will be smaller, like a smaller population that they're,
yeah.
observing. If we can do stuff on a bigger scale, larger scale, different Black people in different countries, that would be
Mm,
good. So
yeah.
definitely more research needs to go into it. But
Into
as
it.
always, if it's something that affects us and we're not always the, majority, we may not really get that funding or that,
Yeah.
research or information into
That's
them.
really interesting. Even when I was thinking a bit more about it, I then also thought about the stigma also associated with it as
Mm-hmm,
well.
mm-hmm.
I didn't know there was a huge stigma. And this is
Yeah,
why people don't even talk about it as much.
mm-hmm, mm-hmm. I think that, and it's funny that you brought up the pregnancy angle. I think for me, actually, it's all about quality of life. And that's actually why I thought about, having this conversation with you.
Hmm.
I just realized, well, obviously I knew already, but I didn't just like the day I messaged you, I was just like, my life is so much better since I had the surgery. And I just feel like more people should, be aware of this. That's really why I messaged you because remember I had said I didn't really want to do a conversation. And then I just like, yeah, like people should know about this. So like pregnancy aside, like, cause it's sad because younger people are now getting fibroids. So before it was something about like 40s, 50s, like older ladies. Now
Yeah.
people in their 20s, in their 30s, and they're having large fibroids. But this is not
Wow.
even people like, okay, for many people in their 30s think about having kids, but those like young people, you get. And it's just like I know how I felt before my surgery. I know how I
Hmm.
felt afterwards. Overall quality of life for me was significantly improved. All my GI
Amazing.
issues, like random bloating, weight
Hmm.
gain, just, different random things improved post-op.
Hmm.
Yes, I also did make some dietary changes as well afterwards, but I know that a lot of my symptoms improved and my quality of life significantly improved after I did the surgery.
Yeah,
Yeah,
but
so
then, look at you saying this, and thank you so much for sharing that. But people don't want to do it. People will delay it.
that the problem is that people are scared. I realized when I started with Nigerians, they're scared of a diagnosis.
What's there to
They're
be
more
scared
scared
about?
they're more scared of knowing or confirming something than even the thing itself. Is that fear of I don't want to go to the doctor? Do you get is even more scary to them than the actual illness. I don't know, just the whole fact of discovering and knowing and
Yeah.
having a diagnosis scares people. Yeah,
Wow.
and some people do have diagnosis and they don't want to address it because of common misconceptions,
Hmm.
right? If you're saying that you're having very heavy periods, you're having very bad and painful periods, right? You're constantly getting stained because your periods are so heavy. You're not
Hmm.
having a significantly good quality of life,
No, you're not. No.
right? So if they're saying that, why don't you go to the doctor to figure out what it is? And I'm like, no, I don't want to. Now I come to. Some people are afraid of hospitals. Like I have a friend that she's having issues, but she's like, I'm afraid of the doctor. And I'm just like, but you need to figure this out, right? Are
Yeah.
you happy with the way your life is right now? Do you get so? I don't
Well,
know.
and look at you.
People are
You're a
scared.
doctor, and I know as part of your experience and all of that, you obviously make people a bit more aware, but a bit more
Mm-hmm.
adjusted to the fact that it isn't as bad. I mean, coming from you and sharing this, people should be able to
Mm-hmm.
see that there is
Yeah.
benefit to
But
it.
you know the irony, I myself was also hesitant now that I come to think
That's
about
the
it. Because
annoying
I had
thing
had,
about doctors.
you see,
I'm
so
going
I
to
had
come
had
to
like major surgery before. I had back surgery before. So I'm just like, when this whole fibroid inside, I'm just like, it's not that serious. I can manage the heavy periods. I
Hmm.
don't want to do another surgery again. But it got so bad. And I'm like, you know what? I was now, anemic. My blood level was really low. I wasn't
Oh,
able to take oral iron because it was making me so nauseous. So I had to take iron injection. And I'm just like, I can't do this for the rest of my life. So
hmm.
if there's a procedure, why not?
Yeah.
And this is me with all my information and all my knowledge, but I was just so a bit apprehensive because I didn't want to do another surgery. But
Mm.
I'm
They say
fine.
they say
I'm just
doctors
happy
are
with
the
it.
worst patients.
We definitely are. Yeah, but
Wow. And
overall, I think it's important
yeah,
to.
and then can you I'm just thinking a bit more about the stigma itself.
Mm-hmm.
Why would people even, because I think a lot of the stigma is even based on myths. There's
Mm-hmm.
no
Mm-hmm.
there's no informed, okay, for instance now, if there was a stigma surrounding the common cold, we all know that it's airborne. So they'll say, oh, don't come near me because the chances are if I inhale whatever it is you're breathing out, I will get a
Mm-hmm.
disease. But where are we getting stigma from fibroids from?
That is
Where?
affecting you personally, yeah. I think it's also that thing, that fallacy that people have about like it's affecting, conception and
Conception.
pregnancy. So some people can feel like if I tell this person I have fibroids, they'll come and think I'm infertile, that kind of thing.
Mm,
So I don't want to address it. I don't want to talk about it.
wow.
I'm just going to be here suffering in my own corner. And then also some people actually do want to, they want to address it, they want to seek help, but they don't have the means to afford it because
Yeah.
surgery, if you're doing surgery, you have to pay for it, right? So that can be
Yep.
another thing also, like you just don't have the means to access whatever care that you need. So I don't think it's always just about denial.
Yeah,
Some people
yeah,
just want to
yeah.
avoid it.
And I can't help but think that uh, uh, that it's so interesting how the concept of reproduction and having kids would put a woman in a potentially dangerous situation, which would not even be solved by her getting married. It doesn't take the problem away, if you see where I'm going. Um, but it's again, it's just thanks for letting me know about this because it's further opened my eyes about it. Now, let's talk about a few of the myths. So this is facts versus fiction. And just let me know what you think about some of these things. So, first of all, fibroids are a major cause of infertility in women in Africa.
I won't say major cause. I'll say it's one of the contributing factors, but I won't say major cause because really fibroid infertility is very multifactorial. You have
Hmm.
to remember that there's male factors and there's female factors as
My
well.
sister, I almost even jumped into that as well. It's always easy
Yeah,
for the man to say infertility,
yes,
woman, infertility.
exactly. Yeah. And unfortunately, that's just how medicine is right now. A lot of it, even when a couple is battling infertility, and let's say it's even the man that has the problem, let's say the man has low sperm count or
Hmm.
abnormal sperm function or something. It's still the woman that has to do all the injections, that has to do all the, everything that has to do with IVF and things. It's still the woman, even though it's the
No, are
man
you
that has the
joking?
problem.
I don't know.
I'm
I didn't
serious.
know about that.
I'm serious. So imagine that the man has issues with sperm and you have to be the sperm donor, and they're
Yeah.
like, okay, for whatever reason, like you have to be the another person, you have a sperm donor, whatever, whatever. The whole IVF process, if that's what they're doing, is primarily the woman. So all the injections, everything is the woman. So even though she's fine, the issue is from the man.
Wow.
She's the one going through all the stress, right? So because of that, there's always that and the fact that women carry the pregnancy, deliver the child
Mm.
with yours, all this kind of misconceptions. There's always that thing that like infertility is primarily the woman's whatever, but it's 50-50. There's male and there's female factors,
Yep.
right? So it can be one of the contributing factors. Somebody can have fibroids. I know many people that have had fibroids and still had their children
Mm-hmm.
successfully, like it didn't affect them getting
Yep.
pregnant, having the
Yep.
kid. Do you get? So there are multiple factors that can contribute to infertility.
Thanks a lot.
Fibroids can be one of the things,
Oh,
more in
thanks.
terms of affecting implantation, but it's
Mm.
not a contraindication to pregnancy. And many people still successfully conceive, carry the pregnancy to term, and
Mm.
deliver successfully,
Oh,
even
thank
with
you.
fibroids.
Thank you, Chi. That's quite useful information. Here's another one. That the highs, you know how it is, especially in some African communities in Nigeria, for instance, with
Mm-hmm.
all the economic hardship and the rest. Some have said that things like the hardship, discrimination, or pressures from the society
Mm-hmm.
contributes to fibroid growth.
I know about that one about hardship share because even in this place, that the life will be a little bit tough. They
Mm.
still have fibroids. Because when I had my surgery, I asked my doctor, I'm like, do white people get fibroids? He's like, yeah. But he just had like a 20-something-year-old like white girl that had fibroids. So white people still have fibroids. People over here have fibroids. Like it's not predominantly Nigerian thing,
Hmm.
So
Please, we're going to because I remember I forgot to even ask you specifically to
hmm.
elaborate a bit more on the symptoms themselves, please. We'll come back to that, but
Mm-hmm.
let's just finish this
Okay.
issue with myths. Um, does some people say fibroids always causes pain? What do you think about that?
So everybody's symptoms present differently. Some of the bigger things with fibroids is more about change in your periods.
Okay.
So if you're having very heavy periods, it can be one of the big signs of fibroids.
Hmm.
Painful periods can be a big sign of fibroids. Sometimes too, the fibroids themselves can have complications. For example, because just imagine like a mass, a ball in your uterus.
Yep. Yep.
It can get so big that it can outstrip its blood supply, and then that can cause pain because of infarction. So
Yep.
that can be a source of just like an acute change in your symptoms, and you have sudden pain with your fibroids because of like infection. So they're not always painful, but sometimes it can be. Some people can just have painless, very heavy bleeding,
Hmm.
right? Some people can have irregular bleeding. So then and that's something that I don't think is well studied, because even us, like, in training and things, one thing that was talked about is all the potential GI issues from fibroids. So like bloating, constipation,
Yep.
just a general sense of fullness, discomfort, also signs
Yeah.
of fibroids.
Wow.
So
Okay.
yeah.
I can't. This is why I do. This is why I do what I do. This is why I talk with who I talk with. I just feel better. I feel all the more wiser from having this conversation with you. You have no idea. I'm going to be raising my chest now when I go outside. Anyone can ask me any question.
Yeah, I've learned something now.
I've learned. Eh? Okay. Birth control causes fibroids. What do you think?
Nope, 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 nobody,
Okay.
nope. The thing with birth control has everything in medicine, and I'm saying this because I had to do all this stuff. I also did my research also. So disclaimer: I'm a pediatrician. I'm not like a gynecologist, so this is not my field. But
Hmm.
because it affected me, I did some research. The hormones in birth control sometimes can help actually to reduce the rate of growth, and
Hmm.
in some people, it can contribute to the rate of growth. So it doesn't necessarily cause it, but in some people, it can affected, either increasing or decreasing, or at least stalling the rate of growth. But it's not like a direct causation of
Yeah.
fibroids,
Hmm.
right? But
Okay.
right now, we don't really know what causes fibroids,
Yeah.
basically.
Yeah. No. No one knows. No one. There's a lot of like you said initially. It could
And
be.
it's not everybody that's on birth control that has fibroids. So if it was a direct causative thing, it's like, oh, once you have birth control, just the fibroids, not everybody.
Hmm.
So
Okay. Um. Genetics. If your mother had fibroid, you would too. Look at that
I think
smile.
there is a strong family history. There's a strong family history of fibroids, but it may also just be the fact that, we're all African. So it may
Hmm.
also be that. But I think there's definitely a strong family history,
Okay.
a
Okay.
contribution of
Okay.
family history.
Thanks for that with regards to the myths. Let's come back to symptoms.
Hmm.
You've talked about pain, you've talked about bloating, you've talked about, just that feeling full, general feeling
Heavy
full.
periods also.
Yeah, yeah, yeah. So heavy periods. I'm sorry, I'm a man.
I was
What?
just thinking that.
Yes. So when you say heavy periods, what
Hmm.
does that mean? How is it different from a normal period?
So everybody's period is unique to them,
Okay.
but sometimes the period will change. And I think also another common thing with us, because we like that whole suffering mentality, you can have consistently heavy periods and painful periods, and you're just like, oh, this is normal. But it's not normal to have heavy and
I
painful
shouldn't be
periods.
laughing when you said something really funny about
But
Nigeria
it's true.
suffering in
But it's
silence.
true.
Oh,
Because you see people like every month they're in pain, and like, oh, I can't go to work because my periods are so bad. And it's just like, oh, have you had this investigated? Because really, periods are not supposed to be heavy or painful. But
hmm.
we just think that's how my periods always are. And it usually ends up being that there's something wrong, right? So in normal periods, I don't want to go into too much bloody details,
No, that's fine.
but a heavy period is basically if you're using more than at least 5 or 6 pads in a day. If you're having to change multiple times, some people have changed like every like 1 or 2 hours just because they're getting soaked and they're getting
Yeah,
stained real quick.
yeah.
If your clothes are getting stained because your pad is too full, that
Hmm.
you within an hour you're gushing, you sit down, you're getting stained. That's all signs of a heavy period, right? You can't sleep through the night because you have to wake up multiple times to change. That's signs
Wow.
of heavy period. Some people double up, so they go to bed with, or even during the day, they're wearing 2 pads and 2 underwear just because they're trying to get ahead of it. That's all signs of heavy period, right?
Yes.
And me personally, I didn't even realize that it was so bad until I started having normal periods, and I'm like, oh, okay, this is what people are enjoying. Like, okay,
Wow.
so that's something about suffering and smiling. You're just there, you're like, oh, this is my normal, but It shouldn't be. You should be able to sleep through the night without getting stained.
Yeah. But I see how some people might even in some I can see the possibility of even possibly wearing that suffering in silence as a badge of honor.
Mm-hmm,
Um,
mm-hmm.
that thinking there's something special about it when it could actually be a problem
Exactly.
instead.
And it's a problem, yeah. And some people, that's just how they're like, oh yeah, I'm on my period and I can't do anything this whole week. And it's just like, but that's not normal though. You can't just sit down in the house
Yeah, and then they'll say
because you're on your
something like,
period.
"Oh, well, it's always been like that," and then
Exactly,
they'll be like,
exactly. And
"Oh,
not to like, not to disregard somebody's pain,
hmm,
but it's not normal that you shouldn't be able to function when you're on your period. Do you get? Like, if it's that painful, and there's other things that can also cause painful periods, like aside from fibroids,
yeah,
right? So it's always good to investigate things.
yeah, 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 I agree." Okay, thanks for that. I'm better. Um, so is there a reason why why? Because I looked at this and it says that African women not only have a greater chance of having fibroid, they also have more severe fibroid related symptoms. What do you think? Well, I think you've answered this before already in terms of it might be food, it might be lotions, hair
Mm-hmm.
lotions, and
I
all of.
think also for us, it may also be that we're also not getting diagnosed early. Because think about it, once you have
That's
something, one or two things changing, people here are more like health conscious, they're more into preventive medicine. So it's like, okay, my period has always been regular and light, now they're heavy. Quick, quick, you're going to the doctors. In Nigeria, we don't have that like readily available. So just like, okay, my periods have changed. Maybe I'm stressed. Next
mm,
month again, it continues like, it's okay. You just adjust, adapt. Do you get? By the time it gets so bad, like, okay, this is embarrassing. I'm getting thin every time. Like this is too heavy. You're having those fibroids have gotten bigger.
yeah.
So it may also just be that by the time we're seeing them in hospital, it's like,
Mm,
more extreme, more severe. So it looks like, oh, black women just automatically have worse fibroids. But it may just be from late diagnosis also.
yeah. And I didn't even know that it increases in size.
My dear,
Oh
it
my
increases and it
goodness.
also recurs. Just FYI. I know we'll talk about treatment later on, but it also
Oh,
comes back.
okay,
Yeah.
we'll
The
come
fact
back
that
to
you
that.
remove it doesn't mean that it's gone forever.
I'm glad conversations like this just make me understand how limited my actual knowledge on some of these things are. So it's good. It's very humbling. So differences in healthcare systems, you've talked about that. Um, let me put it to you this way. If you were in charge of somehow diverting funds or controlling funds, if you were the health minister in terms of fibroids, what do you think you would do in somewhere like Nigeria, for instance?
So I'll focus more on like health education and then screening. Like for me, I I knew I had fibroids since like 2018 and it was like an incidental finding. So I was having all this like random belly things. I did an ultrasound and
Hmm,
then I saw that I had fibroids, but that wasn't because of my belly issues because they were very small. So I've
hmm,
been watching it. So every year I do ultrasounds and things.
hmm.
Not everyone has access to that,
Yeah,
right? So a good tool will be health education like we're doing. And then just baseline screening, I'll want to offer like baseline ultrasound. So I need to know. So if you come now 2 years later and say, okay, now this has changed. I know that when I saw you 2 years ago, nothing was there.
that's a good one.
Now we have this growth. I can kind of say, okay, in this time, this has increased substantially. I think we should be more aggressive with managing it as opposed to just watchful waiting, which is kind of what I was doing with my doctor before. But she said, hey, just, FYI, you may have to do surgery at some point, and that kind of thing. So I think having those interventions would be good. And if
Hmm,
we can actually have more options for treatment
hmm.
that is affordable,
Yeah.
that's also good too. Because some people they have a diagnosis but they can't treat it, so
Yeah,
it's
yeah,
just there.
yeah, 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 yeah. I agree. I agree. It's I think a very useful place to start would be with teenagers in schools. Um
Mm-hmm.
um because it would be very nice to catch, like you said, get them young because again, like you said, a lot of the severe symptoms associated with fibroids in African women might just be a case of late diagnosis.
Mm-hmm.
So
Mm-hmm.
bringing this kind of information early enough, especially because when I was in school back then, I know there were awareness programs when the children hit puberty, they'll come in.
Mm-hmm.
A lot of non-governmental organizations will come in and distribute pads and all those kinds of
Mm-hmm.
things to
Mm-hmm.
encourage ladies to be more aware of their cycles and all of that. So this is easily something that could be fused in with that to spread the
Mm-hmm.
information. Mhm. Okay, so food. Um, does processed meat have an impact? any of this, because my dad will say something like, oh bless his soul, will say something like, eat more natural foods, eat more, all these
Mm-hmm,
processed
mm-hmm.
foods are causing everything. Is they say processed food is causing cancer, it's causing this. Is processed food causing fibroids as well?
Well, nobody really knows, right?
Mm.
But in the general conversation of healthy living, I'll always recommend, try to cut down on processed foods, especially processed meats. We do like lots of sausage, um, minced meat,
Stop
you know.
now. Yeah, now which one are you doing now?
There's all those things. Can't be.
Tell me about mental health and how you feel this kind of contributes to the mental health of people generally, those who may be living with fibroid.
Hmm. Well, as with everything, it definitely does have a big impact on mental health. I feel like if you know that there's something foreign, weird in your body, you're always like side eyeing it, like, oh, this weird thing is happening. Could it be because of this thing that I have? I
Mm.
think for me, it significantly contributed to my anxiety because I'm always worried when I'm on my period. I'm like, do I have enough pads? Am I going to be staying when I go out? Am I going to be staying this night? So even now that I've done the surgery, that I'm fine, I still have that stress. Like, do I have enough pads? And it's like, yeah, you don't need 8 pads in a day. You're fine before, like, you're okay. Will I be staying in the night? I'm not. I'm fine, but I still worry about it. So I don't know.
Wow. And it oh, this is a wonderful thing. Just because it's like I can only imagine what it's like having something on your in your body that you
Mm-hmm.
literally don't have any control over. So for instance,
Mm-hmm.
I'm carrying extra baggage, and if it were a bag or something, not to say they are the same, but if it was something
You
I was
can just
carrying,
drop it.
I won't
Mm-hmm.
I won't mind just dropping it and saying, oh, that's light.
Mm-hmm.
That's relief.
Mm-hmm.
But you get up, you go somewhere, it's with you as you're moving.
Exactly. Exactly.
Oh my.
Yeah.
Uh, oh, and some people complain of, chronic back pains and
Mm-hmm.
all of
Mm-hmm.
that. So, okay. What now? Let's talk about menopause. Well, do you have any knowledge about the relationship between menopause and fibroids, and waiting till then to have it or not have it?
So I
Mm,
think I guess this also ties in with like treatment as
mm,
well, right?
mm.
The biggest thing with fibroids is the potential for complications. I think the biggest thing would be risk of anemia from all that blood loss. So imagine every month you're bleeding excessively. You're putting yourself at risk of anemia, right? So some people have such bad, bleeding, heavy bleeding that they have to have blood transfusions. So how long of your life do you want to wait till menopause for it to stop? Exactly, right? Two, some people can go on to be cancerous, or it can actually be cancerous from the beginning, but some people will just assume that, oh, I have this growth. We just assume it because you won't know whether something is malignant or cancerous until you biopsy it and do the studies
Yep,
and check what it actually contains. Some
yep.
people actually have uterine cancer or like a cancerous fibroid,
Mm,
and it's only detected when it's removed. So there's also that risk as well of you just carrying cancer and not knowing that that's what you have.
mm. Wow.
So I definitely would not advise waiting it out in menopause because also there's higher chance of it changing when someone is older as well. So more it's older people that tend to have cancers and stuff. So that's
Mhm.
more a risk in older age. And
Wow.
then regarding treatment,
Mm,
it's unfortunate because in Nigeria people sometimes are scammed. I know some people that do like herbal stuff. They give you like some certain concoctions and say this will shrink your fibroids. Then you go and meet them and then they'll be showing you things and say yes, this is the fibroid that we pulled out from you. Doesn't work exactly. And you'd be surprised how educated people are doing this thing. They're drinking this thing. They're going to these people. It doesn't work. The definitive thing is surgery, be that in myomectomy, so just removing the fibroid, or hysterectomy, so removing the womb with the fibroid. There's also some non-invasive, I would say, but still kind of invasive methods. So like
mm.
the uterine artery embolization, which basically means that they would interrupt the blood supply to the uterus,
Yep.
hoping that it will
People
shrink
shrink.
the
Oh,
fibroid.
yeah, yeah.
Exactly. But the risk of that, because I had inquired about that, is that it can actually cause complications because the uterus itself can have issues with its blood supply and
Mm,
it tends to be more painful also. You go for surgery, you have your post-op course, you're fine, as opposed to this takes a little bit of a longer time with the uterine artery embolization. So for people who are younger, still want to preserve their fertility, so
mm.
childbearing age, we recommend myomectomy. If you're past childbearing age, or you've completed your, what do they call it? fertility goals,
Yeah.
then we recommend hysterectomy, which is removing
Oh,
the uterus. And
wow.
that's more definitive because there's no uterus, so there's no going back. With
Mm-hmm.
myomectomy, there's always a chance of recurrence.
Mm.
We were taught that fibroids grow in a lazy uterus. So it's like if there's no picking there, fibroid will grow.
Okay.
So
Okay.
there's always a risk of recurrence.
Wow. Okay. Okay. That's a
Hmm.
lot of information to
A lot.
process. It's a lot, but thank you for for taking me through that journey. Um, Fibroids and cancer rates. You've already said that there's a chance that it could become more of a serious issue as well, which basically heightens the reason why it should be taken out. Um, what I'm going to ask is this, but this is not definite. It doesn't definitely always lead to cancer.
It doesn't always lead to cancer. It may just be that the person had the primary cancer. It's not like it was fibroid that turned to cancer. But
Hmm.
sometimes the fibroid can progress to be cancerous, but not every time.
Okay. Okay.
Yeah, just rarely.
Hmm. Okay. And then we've talked about local therapies as well and how dangerous those are. Um,
Mm-hmm.
I've seen those movies where, like you say, they bring out some mass at the end of the
Mm-hmm.
day and say, "This is what was taken out of you," and you're
Like
like,
how
"Okay."
we just went there and pulled the thing. Like what have you even said? I like it makes sense when you hear it. Was just like I didn't do you think they were daft? Like what have people say? Just went and pulled the thing out just like that. It's shrunk. Then
Yeah,
you
so
pulled it
in
out.
case you haven't noticed, audience, Chinonso was rolling her eyes. So just yeah.
Multiple times also.
Okay,
Hmm.
so we're slowly coming to it, to the end of the conversation on fibroids generally. Um, but I would like to know in terms of your own advice with women on this issue. What would be your advice to women?
Well, I would say if something feels off about your body, don't disregard the sensation, don't disregard the emotion, go and check it out. And if they do find that something is wrong, try as much as possible to address it. Because I think sometimes we're also afraid of things. And at the end of the day, quality of life is significantly improved when you sort out medical things early. Because even for mine, people always ask me, that wasn't disturbing you like that, was it so big? I'm like, they were a bit big. It wasn't like they didn't have that many. Like how people be like, oh, they had like 35 birds, that kind of thing. There weren't that many, but it was
That
disturbing me.
wait. So it's not just the one.
No, that's called fibroids for a reason. I had
I'm
15
sorry, Chi.
of different sizes.
Wow.
Yeah, yeah. Some people have 30, it's just like, there are multiple. Yeah, so address it and you'll feel better afterwards. General obviously with surgery sometimes there are complications and things, but most time and it's so prevalent. I know so many people that have done I feel like it's not like a rite of passage. Like if you're a black person in your 30s, like you haven't done fibroid surgery, I really you're still
Wow.
slacking. Yeah.
Okay, so your general message is go for checkup regularly, and if you see something is off, this is even
Mm-hmm.
more of a reason to go see a doctor. And
Yeah.
then obviously, if it's diagnosed, get rid of it as soon as
Mm-hmm.
possible. And I definitely stay away from herbal remedies.
Yes, exactly. You don't work and they take your money.
Phew. Okay, now we've gone past the heavy stuff. Chi, you're a medical doctor. Tell us a bit about your journey to medicine, and how it's been.
My stuff from when I was child and I had my
Yes.
birth
So was it one of
certificate
those
and my
things where
certificate.
father and mother said you
How
must
far
be a
back are
medical
we going?
doctor?
I don't even know why I wanted to be a doctor, but I just said I've always just wanted to be a doctor for the longest time.
Hmm.
Um,
Did you
you
write
know how
jam?
it is. Yes, I was like, let me just jump to that side. So now it is like primary school, you're trying to get into secondary school, secondary school, you're in science
Hmm.
class, jam, I don't know, jam was just sad. So I tried to go to school in Nigeria. I wrote jam twice. I didn't get the cutoff
Oh,
marks for
see
UNN.
you are waiting at the column. They didn't even touch you, and you just wrote jam twice.
Yeah,
Hmm.
I wrote that twice. And then by the second year, I'm like, I have to have other options. So I wrote SATs.
Hmm.
I applied to Ghana. And then what else
That
did
is
I
true.
do?
I forgot that.
Yeah, yeah. So I got admission to study biological science in Ghana. And then after 1 year, I got into medical school. So as at the time anyways, you have to do biological science for 1 year, then you enter medical school. So it was
Hmm.
very competitive because there were so many of us in biological science.
Yeah.
But to the glory of God Almighty, we entered. So that was really it. I think getting into medical school was like the biggest thing, and then just like keeping my head down, finishing. After school, I came
Keep your
back to
head down.
Nigeria.
What was that about? Keep your head down.
Mhm.
I beg you.
Struggling to finish to pass my exams and things. Yeah, it's a summary. It's a summary. I had you summarize 6 years in what's happening. Um, I came back to Nigeria, sad thing, after medical school.
Hmm.
It took me like a year to get a house job, but a very sad moment. Finally got a place to do my internship, the house job. Did that in Umahia I was there for a year. Then I started preparing for the American exams.
Okay.
I did my exams in 2018, I think, and then I applied in 2019, and then I matched. So I came to America to do my training in pediatrics. I was in New York.
Why
Did that for three
pediatrics?
years. Sorry?
Why pediatrics?
I know. I've always liked children. I
Huh.
find that they're
They are
they're easier
gross.
to work with than adults who are very gross and annoying. And I don't know, it's either I became a nanny or maybe just a teacher. But something with children, Sha. I think this was a better option.
Oh no no
It
no!
pays better.
It's fine. I'm fascinated with medical doctors. I feel that there's a bit of I mean, not you, but I feel generally medical doctors are proud people. Um,
Well,
I feel there's carrying shoulder everywhere. You know that they've done medicine.
well,
So, so yeah.
well. We have suffered, so it's only proper.
So you're one of them. Okay, so this is my hot take. No, not my hot take, but a few people's hot take that female doctors are more capable than male doctors.
Wow, we have to go there, right? Me, I'm a feminist, so I always support the ladies. Yes. I think also it's that cockiness that comes with being a guy. Men always feel like, oh, I know it, I know it. And it's just like, sometimes it's okay to say, I don't know something, even though you may look somehow to your patient, but if you don't know it, you don't know it. But
Hmm.
it's that whole thing of, oh, I always want to be right. I tend to go for female doctors, if I'm being honest, because I feel like they're more thorough and they're more cautious, which I
Hmm.
prefer. I
I think
don't really
even
look at
people have
stories.
said it. I checked it online.
Mm-hmm.
I didn't even know it was a thing that even male patients to some extent prefer seeing female doctors because there's
Mm-hmm.
also a level of empathy
Mm-hmm.
that they seem
Mm-hmm.
to have available to them than with the male.
Compared to exactly.
It's just my hot
Compared to
take.
a counterpart.
Yeah, just my hot take. Um, but then I also heard I spoke with a female female doctor once, and she said that she's had a few funny male patients. Now she said that there was one patient that said to her, during her, during her career, very early on, he said to her that I have your age mate at home.
Yeah. Okay. This I work with kids, right? Last, they'll just tell me that the way I'm talking is funny. Or they'll ask me, do I have children? I don't know why kids always ask that question. So random. But I appreciate it.
Has
Yeah.
anyone given you number to call them? Or has anyone
That
asked you
what
for their
happened.
number to
That
call?
what that what happened. So that the children will embarrass them. They don't kids they're so funny. They'll be like, that's me giving her. What's mom gonna say? Kids are so they just talk.
Oh,
Yeah.
oh my
So cute.
goodness. Okay, now that's your medical whatever. I'm going to ask you a few random questions that are not connected. So you look like a fighter. Have you fought before? And who won?
Physical fight.
Yes, physical fight. You look like you boxed
I'm
somebody.
pretty sure when I was in secondary school, I fought. I don't
Okay.
know who won, but I
How will
used
you
to have
know?
a hot
It means you
temper
lost. When
before.
people bring that kind of answer out, it means that you were beaten. There's no,
Yeah.
you cried
I don't
home.
know if I was bitter.
Ah,
Yeah.
not
Mm.
so.
But I don't fight anymore. My fighting days are over. I'm calm now.
Yeah, you save lives, apparently.
Yeah. Can't be
You
beating
don't,
people in the office.
yeah, you don't send people to A&E. You won't want
Mm-mm,
to.
mm-mm.
Okay, one place you would love to visit.
Hmm. Where do I want? This is okay. Paris, I guess.
Okay, okay.
They
France.
claim it's a romantic city, but also dirty. So who knows? I don't
To me, I heard initially it was even in my what's it called? A list of places to visit. But there's
Mm-hmm.
somewhere else that's there. Still France, but not Paris. I hear that
Urban.
Paris is very it's very urban. It's very busy. You will even not really
Mm-hmm.
enjoy it. The place I want to visit is the southern of France, where they make
Oh,
champagne.
okay.
It's on a different level there. So the
Different level.
poshness of it, that's the
Post side.
Okay, so um, if you were living for a place right now, what is the one thing you would take
My phone.
apart from your passport?
My phone. Lipstick. What else?
Lipstick.
Yeah.
Wow. Some people, the way people take this beauty thing there. Wow.
I never be
Lips.
caught unprepared outside.
Okay. Phone definitely I'll take with me. I'll definitely take
Phone,
phone,
definitely.
but I think I will always take at least a pair of underwear. But since you've gone with lipstick, it's fine. Everybody has priorities. It's fine. Just whatever your priorities are. Okay, let me ask you a bit about food. You've been in the US now for a while. What's your
Mhm.
non-Nigerian meal of choice?
If I go out, because everything here has cheese and it's so annoying. If I go out
I
and
love
it's like there's
cheese.
no
What's all
cheese,
that about? I
anyway,
love
I'm
it
lactose
too.
intolerant, so
I
I don't
love
like it.
it. Initially, I was against cheese, but now there's even
Mm-hmm.
a cheese and wine. Oh, it's so posh. It's so
That's
lovely.
so pretentious. Cheese and wine, cheese and
Get out.
crackers. Like,
Get out. What do
count
you
me
know?
out, count me out.
Okay.
I will just go for a burger, honestly, just like hamburger, because you can't really go wrong with that. Because
Mm.
most times food is like it's not even sweet. It has to just food at home. Mm-mm. So yeah.
Oh, some things will never change. Okay. All right. So, okay, that's your food of choice. All right. Since we've done that, let me ask you a few other ones. Just wait. So give me. We still have another 5 minutes. I'm almost done with your drawing. Just so you know. Let's cool down.
The
Cool
drawing
down.
was ongoing. Okay.
I don't know. Looking at you, looking at this drawing, it sort of looks like you, but I'm not sure. We'll see very soon.
Hell, okay, right here.
Have you ever considered owning a pet?
I think about a dog sometimes, but I don't have time. It's like having a child that doesn't grow up. So yeah, it looks good in the movies, but it's not very practical.
When did you become so brutal? Like, I'm like, when did you become so brutal? It's like, I would love to have a dog. My missus is a bit scared of pets at the moment, so I think I need the kids to grow up and I would vote her.
Mhm.
But right now, we're not allowed to have any of that, which
Yeah,
is
who's going
funny.
to take care of it? They have lots of needs.
Well, I don't know now.
Mhm.
Okay, here's one. Recommend for us a book, a song, or a movie.
Hmm. What book did I just read now that was good? Song or a movie? Good.
Yeah. Any of those three or all three. There was one person I had on my show. He actually gave three of those. He even added extra. So recommend a
Extra.
book.
So I'm
Is
currently watching a series, well, not a movie, a series called The Midwife, which I think is a good. It's medical without being too medical. I don't like watching medical shows. It's on Netflix and it's very like 13 seasons or something.
okay. So
So it's
it's got
good.
drama
Mhm.
elements to it and all of that.
Yeah, it has drama, but there's also lots of women in labor. If you guys are okay with that.
Okay.
Yeah,
No.
it's basically about like women in like I don't know the 1940s or something in London and all their social whatever around it. So it's
Okay.
good for some medical, a little bit of medical drama, some romance as well. If people are into that.
Okay. Okay. Well,
That's what I'm watching.
I think
Books, I can't
romance is.
remember. I feel like I haven't really done a good book in a while, so I don't have any good
I'm
books.
struggling with books, but I'm okay. I think I'm okay
Yeah.
with this year. This year, my goal is to read one book per month. I am
Oh,
almost there. I'm almost there. This is
wow.
already the
Okay.
beginning of April. This is already the
Mm.
beginning of April, and I finished my first book, and I'm close to finishing two. I'm reading two books at the same time. I'm close to finishing them as well. So I'm
Oh,
really good.
wow.
And then I already have my third book,
Hmm.
fourth book picked out already. So I'm really doing well book wise. The books I'm reading are fiction, but I want to. There's a particular. Have you heard of Jason Statham?
Mm-hmm,
Yeah.
mm-hmm.
So
The actor.
there's his biography that I have just
Oh.
that I've just picked up. I want to read it, but then I've also been looking for Val Kilmer. Do you know Val Kilmer?
Mm-hmm.
Oh, gee. Have you watched any of the Batman movies?
Mm-hmm.
Okay. Do you remember any movie called Batman Forever? Oh, you
Hmm.
won't remember. Well, Val Kilmer. Have you heard of Top Gun? You must have heard of Top Gun.
I have. I saw that I even saw it recently. Like I saw
Yes,
something
because
about it
he's just
recently.
passed away. He's just
Oh, he
passed
died.
on.
I was like, I saw something. Oh, I
Yeah,
know.
so
I
Val
read about
Kilmer's
it
just
recently.
passed on. So I'm
Hmm.
actually looking for there's an autobiography of his as well. So I'm going to be reading
Oh,
that as well. Yeah, it's just
okay.
random things. Okay, so just like two more questions now. What is the one thing you wish people knew about you?
Interesting. Interesting.
Thing something that, for instance, you think if they
Interesting.
you think you know about yourself, but they can't easily detect.
Hmm. I guess it depends on like where, but
Okay.
I guess I want people to know that I'm not as scary as I look. I think they're afraid
You
of me
don't
in the
even look
office.
scary.
I'm very, I can be strict sometimes. I guess I want people to know that my back is worse than my bite.
Oh.
I guess I talk plenty, but
The only thing I've
I know.
never witnessed with you, one thing
Yeah.
I'm curious about is you dancing. I don't see.
And you will not see, you will not see. I have to be drunk before I dance. So it's okay. I'm not drinking again, so it's okay. You will not see it. But I've been dancing more these days. Funny enough, I didn't used to dance like that before. No,
Mhm.
yeah, that's right.
I thought you were, when you first of all responded to my comment about the dancing, I thought you were going to say you will never see in Jesus' name. I was like, it's not that serious. It's not.
What you know, everyone. Mm-mm.
If you could wear one color for the rest of your life, what will it be?
Red.
Ooh, I like. Oh,
I
nice.
know how I'll pull it off, but it's my favorite color too, so I wouldn't mind.
Wow. It will, for
Hmm.
me, guys, now, I won't go with anything flashy. So either be black, gray, that kind of thing. And now that I'm thinking of it, even maybe this navy blue. Okay, now, final question. If you could, oh no, two more. I like this one. If you could go back to any point in time in the past to
Mm-hmm.
relive an experience, not to change anything, but to relive an experience, what part would
Mm-hmm.
it be?
To really.
Yeah, take your time.
I don't know if I remember it, but I guess I'd like to go back to my childhood, like younger, because I can't remember it.
Hmm.
So go back and live it again and see how it felt. I'm curious to know how it felt. Like you know how you have all these memories and you think you're so happy, but like in the moments, were you really happy?
Hmm.
Did you sense everything that was stressing everyone at the time?
Okay. I would love to I'd love to go back to uni.
Oh,
Um
really?
yeah. I think I had a satisfying university life,
Mm-hmm.
satisfying university experience. There are times when I wish I could have done a few things differently. So it's not that I would change. Okay, maybe I would change. Maybe I would go to a few parties. Maybe I would um I say play a bit more, but people say I was already too playful back in school. So they don't know what more I can play. But anyway, I would like to go back to uni days. I would like to
Okay.
see, I would even like to know how, I'd like to observe how people saw me. So really just look at people when I'm
Mm-hmm.
just around and really know what their
And
impression.
read their mind. Mm-hmm.
What? But
And read their mind.
yes, that's one thing I'd like to know. But some of these things you cannot change. Anyway, all I can say is it's been so wonderful to speak with you, Chino. So
Thank you for
thank you
having me
for
on the
coming
platform.
in to share with us your personal journey with fibroid, but also sharing with us the knowledge about it as well. Because I tell you, I am I'm wiser now as
Blown
a result
away.
of speaking with you. More
Glad.
aware of the gravity of the situation and how serious it is. I'm also happy that we had this opportunity to catch up. Now, I'm working on this image, and don't be laughing at me now. I've not even shown you what it is.
Oh,
And
okay.
the image is not yet finished. So there's still a lot to do to this.
I can
Because
imagine.
no, there really is still a lot to do to it. And it's not yet finished. It's meant to have a celebration effect to it. So, but this is what I was able to do. I don't even want to show you yet.
Hmm.
It's looking so good. It's one
Okay,
of
I'm
my
ready.
You're ready. Yeah, so okay. So in the time when we were speaking, In the time when we're speaking, this is what I was able to do.
Wow. Just
So,
very, very accurate likeness. Very, very accurate.
so I haven't
Yeah,
done much.
good though.
Yeah, I haven't done much on it. I'm still going to work on your complexion. I'm going to put a bit more details on the hair. And the reason why
Mm-hmm.
I did this and you have that celebration cap on there is obviously because it's your birthday. And I wanted to,
Oh,
yes,
okay.
wish you a happy birthday again. But yeah,
Oh,
I'm most likely going to add possibly some wine glasses here and you
hmm.
probably giving a toast somehow, a toast to
Okay.
life. Because you said something really interesting that I love, how as a result of having this surgery, you've actually had a better quality of life. So, yeah, yeah. So thank you so much, G. I really appreciate you coming on this on show
You're
to have a
welcome.
conversation with us. So it's been fabulous having Chinonso, Dr. Chinonso here to talk to us. She said a bit about herself, and she's actually given us more to think about in terms of fibroids and how they affect women, especially women of African descent. So yes, help me to appreciate Chinonso. I can't wait to have her on my podcast again. This time, hopefully, in a different capacity, because she is definitely a wealth of knowledge. And for the rest of you, please don't forget to like, share, subscribe, and I'll see you when I have the next guest on the show. Thanks a lot. See you then.